Good morning. I'm Dr. Narisra Srikureja. I'm an obstetrician and gynecologist here at the Mission Hospital in Bangkok. Today I'd like to talk to you about cervical cancer prevention. So what is cervical cancer? Cervical cancer is the cancer of the cervix, which is the lower part of the uterus that connects to the vagina. The most important risk factor of getting cervical cancer is a persistent infection with the HPV or the human papilloma virus. Most people who are sexually active will contract HPV at some point in their lives, but the majority of these people are able to clear the infection away on their own. Now, there are some people who are unable to clear the infection. Maybe they have a suppressed immune system, and in these patients, some of these women will go on to develop cervical cancer. Today, I'd like to talk about 4 things that you can do to reduce your risk of cervical cancer. The first one is to enhance your immune system. By consuming lots of fruit and vegetables, nutritious foods, good quality fats and proteins, getting adequate sleep, and exercising regularly, you can boost your immune system, which can help you eradicate an HPV infection that you may already have. If you're a smoker, I would also highly encourage you to stop smoking. Not only does nicotine in cigarette smoke weaken your immune system, cigarettes also contain many cancer-causing substances. The second thing that you can do to reduce your risk of cervical cancer is to reduce your risk of catching the HPV virus. As we mentioned earlier, the HPV or the human papilloma virus is contracted sexually. So by using barrier protection such as condoms and by limiting the number of sexual partners you have, you can reduce the risk of catching HPV. The third thing that you can do is to get vaccinated with the HPV vaccine. The HPV vaccination has been shown to reduce the risk of getting HPV-related cancers by up to 90%. This not just includes cervical cancer, but also cancer of the vagina and the back of the throat, the nasopharynx. Currently, there are 3 HPV vaccines available. The Cervarix, which protects against 2 most high-risk HPV, the HPV 16 and 18. There's a Gardasil, which protects against these 2 as well as warts. And then there's a Gardasil 9, which protects against 9 high-risk HPVs. These vaccines are approved for children 9 years and above and are most effective when given before becoming sexually active. The last thing that we can do to prevent cervical cancer is to get regular screening. Currently, there are 2 types of screening available. There's the Pap smear, where we take a few cells from the surface of your cervix and look at it under a microscope to check for any abnormalities. The second type of screening is to look for the DNA of the HPV at the cervix. Currently, the Pap smear screening is available for women 21 years and over, while the HPV test is recommended for women 30 years and over. However, they may be used before or in conjunction with each other in special circumstances. If you have any abnormal symptoms, such as out-of-cycle bleeding, bleeding after sex, or bleeding after menopause, or any abnormal vaginal discharge, I would highly encourage you to visit your doctor. If you need any more information, you can look at the reputable websites such as the CDC or the WHO, or feel free to contact us for any further information. I'm Dr. Narisra Srikureja, an obstetrician and gynecologist here at Mission Hospital. Thank you.